Winaka, namaste, and good evening to you. Tonight on Straight Talk, we speak to two individuals who have not spoken publicly, maybe with people about the situation they face on a daily basis, different scenarios that come to play, but decision-making is paramount for them when it comes to COVID-19. Of course, COVID-19 remains a major issue for the country. The second wave of the pandemic continues. How do we deal with COVID-19? How are we dealing with COVID-19? Vaccination rates, of course, going up with more than 45% of the eligible adult population vaccinated. However, we still continue to see a number of people, unvaccinated and partially vaccinated people, making the majority of that percentage, dying on a daily basis. The cases increasing with many more daily cases in the Western Division, but still deaths being reported in the Central Division. Tonight, we have the head of FEMAT, Dr. Luke Nasedra. Dr. Luke, thank you very much for joining us this evening. Of course, people will be looking forward to what you'll be sharing. Of course, FEMAT is the Fiji Emergency Medical Assistance Program that has been set up, led by Dr. Luke, and the ANZMAT Charlie Mission team leader, Nurse Bronte Martin. Miss Martin, thank you again for joining us. And of course, people would be really glad to hear from both of you on what is happening behind the scenes at FEMAT and of course with the assistance of ANZMAT. Now, Dr. Luke, just for the people, can you please confirm the work of FEMAT following the second wave of COVID-19 in Fiji?
FEMAT, as you have mentioned, was brought into the picture on the COVID response for the second wave of COVID-19 earlier in May, when there was a breakout of cases in the Western Division that resulted in the lockdown of Lautoka Hospital. And with that lockdown of the hospital, the ministry then decided that we need to send FEMAT, and the main task over to the Western Division. The main task is mainly to set up the field hospital, knowing that access to the Lautoka Hospital has been limited, and then we know that the subdivisional hospitals are a bit of a distance away from Lautoka, and so we have to set up a field hospital closer to Lautoka Hospital so that we can then handle the cases, the surge of cases in the Western Division. So we went in to set up the field hospital, and that involves the Vijay, which is the medical boat that was stationed at the Lautoka Wharf. And then we set up a tented facility as the field hospital at the NDMO compound in Lautoka. So we set up the field hospital is mainly sort of as a replica of the services conducted in Lautoka Hospital, and we, on a smaller scale, we set up a 48-bed facility in Lautoka, and we had set up an operating theater, one in the MV Bueti, and also a operating theater on the field hospital. And we look after the emergency services. So we set up emergency services where we sort out the cases, and those cases that are positive, that then they will be sent over to Lautoka Hospital. And we continue to manage the non-COVID cases at the field hospital. And we did that for 1 month in Lautoka. We admit cases in the field hospital, and then we also provide specialist services. So we conduct surgical operations, maternal deliveries. We delivered babies in the MV Bueti and also at the field hospital in Lautoka. And Then we also provide specialist services, other specialist services like cardiology. The pediatricians are there to look after babies. And we also set up diagnostic services and other support services surrounding the work that we do. We also set up a retrieval service where we had a few ambulances that assisted the the Greater Lautoka area and also the Western Division in retrieving the sick who are calling from home or even other facilities. And we provided that support to Lautoka Hospital. We did that for 1 month. And well, as you know, while we were in Lautoka, then the situation changed with the eruption of cases in Suva, and we were required back into Suva. And at that time, we opened up Lautoka Hospital again. And one of the things before we moved to Suva, what we did in Lautoka, we then assist Lautoka Hospital in setting up the sorting and isolation areas so that we can keep the hospital COVID free, even though they are managing COVID cases, but just to make sure that there is no breakout of cases within the hospital again. And so that is how we assist the Lautoka Hospital. When we came to Suva, the situation changes a bit because of the magnitude of the problem in Suva, and the population coverage for the Central Division was quite big. And we set up the field hospital at the Vodafone Arena, and we later on move on to the National Gymnasium by setting up the intermediate care facilities around Suva to support the operations at CWM Hospital and also around the Central Division. And we also provide the same services as we have provided in Lautoka, mainly to support CWM Hospital and the other surrounding health facilities in the greater Suva Nosori area.
Thank you, Dr. Luque. And of course, we'll be getting into more details regarding the services provided by FEMAT. ANZMAT, of course, has come in. The ANZMAT, the Charlie mission team leader, Nurse Bronte. Now, in relation to the support that is coming in, you're working hand in hand with FEMAT. Can you please confirm how your assistance is benefiting the Fijian population?
Good evening, everybody, and thank you, Dr. Luque. It's been a pleasure for the ANZMAT team, so the Australian and New Zealand medical assistance teams, to work alongside our FEMAT colleagues yet again. We have a long history of working and training together, and it's been a privilege to come back and help Fiji during this really difficult time with the second wave of Delta cases from COVID-19. We've had teams in country working alongside of FEMAT since beginning of June. And so for the last 3 months, they've been working across the entire health system for Fiji to try and better help support and strengthen the response to COVID-19. We've been embedded right alongside of frontline healthcare workers inside of Colonial War Memorial Hospital, and also more recently inside of Lautoka Hospital. But we've also had teams supporting our colleagues at FEMAT at the Vodafone Arena, and all of those smaller hospitals and subdivisional health centres that are the front line of the COVID response for Fiji. So that's entailed things from everything from training around infection prevention and control and how to provide safe COVID care when we know that it's widespread in the community, all the way through to very specialist clinical skills in managing the severely unwell and critically unwell COVID patients. We've also provided quite a bit of logistical and operational support to inform the thinking around how we manage our very special resources like FEMAT inside a very stretched health system, which is challenged with COVID-19. And we see that all around the world, irrespective of the size of your health system, the challenges are very significant, and there are very specific needs that we can do to support that. And so we've been able to provide some extra specialist equipment. We've been able to assist the public health response with extra vaccinations. We've also been able to provide support in coordinating and planning the response and making sure the right health resources are being allocated allocated in the right place at the right time. And we've been able to give some of that senior, more mentoring advice to our colleagues, because we've been assisting other friends and neighbours in the Pacific and at home in Australia with the COVID response. So it's been really important for us to walk alongside our Fijian colleagues at this time.
Thank you, and we greatly appreciate your assistance that you're providing to the people of Fiji. Now, Dr. Luque, how is the ANZMAT assistance helping the Fijian frontliners? And what were the challenges before the team came into the picture, came into the country to assist FEMAT?
As explained by Bronte, the ANZMAT came in to support the work that has already been started by FEMAT, and also the other part of the health services in Fiji, CWM Hospital, and other health facilities in the Central Division, and then later on they move on to support the Western Division. And recently, in the last few days, they've been involved in ways in supporting the Eastern Division and also the Northern Division virtually. When ANZMAT came in, one of the biggest support that they have is providing that extra opinion on how we are managing the situation for FEMAT. It's just like this. It's always good to have another set of eyes. They also came in with their experiences and the knowledge, and they look at what we are doing, how we're doing it, and then we make discussions on how we can maneuver what we currently do to fit the situation that we are facing, and also to try and project all the needs that we need to prepare ourselves for the continuing surge in the community. And so, and also they really help us in teaching, training of infection prevention and control measures. And the main contribution to FEMAT was also the setting up of the intermediate care facilities. We have been setting up the Vodafone Arena, but then they came in and show us another aspect of setting up an intermediate care facility, which was done at the National Gymnasium, and that worked out very well with all the staffs and with the IPC measures that they contributed in, and looking at the patient flow, the flow of infectious matters in the intermediate care facility, that has really prevented the staffs from being infected. And I must tell you, Mr. Narayan, that from the time we open and to the time we empty the National Gymnasium, none of the staffs that was working in the National Gymnasium got infected. And that was, I think I want to attribute that to the expertise from ANZMAT when they came in to assist us. Your second question was on the challenges that FEMAT was facing. Now, when we were tasked to be deployed to Lautoka, we knew that this is something that is beyond the capability and the capacity of FEMAT. FEMAT, when it was verified by WHO EMT in 2019, we were verified as a type 1 facility. That is an equivalent to a health center. So FEMAT was just verified, equipped and structured just to provide a health center type of service during disaster. But here we are, we've been deployed to Lautoka to go and take over a service of a divisional hospital. So that is beyond the capability of FEMAT. But that was one of our main challenges. But the good thing is we've been working during peacetime when we go out on outreaches, doing surgeries out in the subdivisional hospitals. We've been responding to tropical cyclones. We've been deployed just recently this year for TC Anna and TCSA. And that is where we are taking up some of the servers, going and set up services in the subdivision. So we sort of have an idea of how to set it up. And with the support of the other government stakeholders, we were able to set up those tented field hospital. And that the field hospital that we set up is sort of a type 2 facility. And that is one of the biggest challenges that we have. And we know that the only type 2 facility within our region is with ANZMAT. And I think that is also where, when we set up in Suva, that is also where they are becoming in very useful, because they have that capability with the type 2 facility. But that is the main challenge. Now, the second challenge is we've got a group of staffs that haven't been trained on FEMAT procedures, on FEMAT team member training. When we started in Lautoka, 94% of the staffs that were managing the field hospital in Lautoka, they haven't been trained or gone through training with FEMAT or EMT. And that is a big challenge for the staffs. They come in, you know, they come out of the hospitals and the health facilities they are working in, and they work in sort of unfavorable conditions. You work in the hospital, now you come and work in a tented facility. That's quite a challenge. And I was very thankful that for the 1 month, they've stood up and they've showed that they can do it. And it has been manifested in the outcome of what we did in Lautoka. And the other major challenge is FEMAT is not equipped for outbreak. FEMAT is equipped for disaster response. But for disease outbreak, FEMAT is not verified for disease outbreak response. But this happens. Somebody has to do it. So we stood up and we did it. The ministry, with the guidance of the ministry and the support from other government agencies and some civil support organizations, we are happy that whatever we have done, whatever the outcome that we have achieved, is the achievement of the whole of government and other support organizations, and with our partners within the region of ANZMAT, that we have managed to support to achieve the outcome. And lastly is the unknowns with COVID. You know, when we started with this second surge, there's a lot of unknowns. And I think that was also another major challenge. We don't know how long will this take. You know, the team that went from Lambasa, they thought they were just going to be here for 1 month, for 2 weeks to 1 month. They ended up spending 4 months in Vitilio. So they just moved into quarantine on Monday. So those are the unknowns. They came in for 1 month, and you don't know how long this will take. And even until today, we still don't know how long. So these are the unknowns that we have. And also the disease process of COVID is also something that is not clearly known. So, but we are thankful. We are thankful to the staffs and the team that they stood up with the challenges, and they put in their best, and people work together in the fight against this pandemic.
Dr. Luque, how many doctors and nurses were involved in the Lautoka operation, and then the operation that continues on the ground in the Central Division and now in other places like Kandavu?
We started in Lautoka. There was the total team of doctors, nurses, and support. There was around 54. That number increased to 120 in Suva. And there is, we have reduced again the number in Suva because things have improved a bit. So the Western team have moved back, and we have deployed a smaller team of the team that is currently in Kandavu. There are 56 personnel in Kandavu, including doctors, nurses, allied health, logistics support, and other government agencies that are supporting the functions of FEMAT.
Now, Ms. Bronte, in relation to, of course, ANZMAT coming into the picture for assistance for Fiji. As Dr. Luque said, FEMAT verified as equivalent to a health center facility, and also were equipped to look after disasters, to work after disasters. And here we were having an outbreak, and things were getting out of hand, out of control. When your team came in, what were some of the things were really glaring at you that you had to fix quickly, and the challenges that the Fiji frontliners had faced that you quickly needed to help to make sure that we get out of the situation?
Excellent question. And I guess, firstly, let me commend Dr. Luque and his team. FEMAT have done a remarkable job in displaying such a huge amount of flexibility, resilience, and leadership. And they are not alone. Every single country in the world is grappling with these exact problems. And we are seeing emergency medical teams like FEMAT, ANZMAT, and NZMAT having to step up and come to the fore and support national capacity in responding to outbreaks, which is not something that we normally would do. As you know, we heard from Dr. Luque, we normally focus on sudden onset disasters. And there are a number of things that are similar in an outbreak, but there are many that are different. And you also heard Dr. Luque talk about those things like duration, so the length of time that you need to respond, and responding for 4 months at a time is a huge drain individually and across a system and on specialist resources. And people that are normally in your emergency medical teams are your health leaders from your frontline health workforce. And in FEMAT's instance, they're drawn from all 4 divisions, and they come together quickly and form a new team and then move around and meet those needs. And those challenges are significant, but we are learning collectively as an emergency medical team community. And particularly in our region in the Pacific, we're sharing those learnings together so that we can be better prepared collectively. And so things like essential support services inside of hospitals, oxygen systems, specialist medical equipment for critical care, and very importantly, systems around how we safely manage COVID patients and keep our staff and community protected in providing the very best medical care for those COVID-19 patients have been some of our key learnings. And there are some really challenging things for big hospitals, particularly like your national hospital, CWMH. How do you rearrange those services so that you can safely manage and redirect your resources, equipment, and specialist people so that they can support that, and much higher levels of personal protective equipment, so masks and gowns and gloves, and also very specialist types of medical equipment like oxygen delivery devices and special medicine that's required for treating those. And so rearranging your health service is very hard at the best of times, let alone in the middle of an overwhelming situation, and the agility to move those resources, particularly across the nation. And when you're an island nation and you have multiple different geographical places you need to cover, and spreading those special resources very thinly is quite the challenge. And so for us, it was about supporting those decision makings, understanding where we're at in the phase of the response and how we can best support and offer that specialist technical advice, or is it providing specialist equipment, or is it in fact working alongside our colleagues at the bedside, which we were doing inside of both Lautoka and CWMH in key areas that we've heard about. So retrieval, so making sure we're getting early access for patients to those specialist medical care, working inside the intensive care and the emergency department areas and the wards that are looking after these COVID patients. So we also were supporting the public health response, because we know that's really important to do both things together. And the way we test and identify and look for those vulnerable groups of patients and preemptively move resources, as we heard Dr. Luque say, so that we can be best prepared for when we see the wave coming and we understand a little better the projection of what happens with COVID-19 when it's being transmitted across the community. So for us, we adopted the same flexible approach, and we listen very carefully and respectfully work alongside our Fijian colleagues. And that is a privilege that we take very seriously, and one that we have been very fortunate to do for a very long time, not just during COVID. So we had a good understanding of the Fijian health system and also of those specialist resources that were already there and how we might best help bring them together and make sure that we could do the best for the most when we needed it at the most important time.
This question is for the both of you. I'll start with Dr. Luque. Of course, at one stage, we had Fiji rated as one of the highest per million population as far as cases were concerned, daily cases were concerned on average. And that was definitely concerning. And when that started and we had a sudden increase in the number of severe cases and people coming to the hospitals needing oxygen, needing ventilators, at what point were you at that scenario of being one of the highest in the world, and how was this playing out at the emergency hospitals, Dr. Luque?
Yes, thank you. Yes, definitely. At a point in time, as you've mentioned, Fiji was right on top of the map with COVID cases. And for us on the at the ground level, that was meant quite a lot of. It's quite challenging because we know that we now need to start preparing for a wave that is going to be much bigger when we then have to assess the capability of our health facilities and the resources that we have. So that was quite challenging. And as that, I think by that time we were fortunate that it's around that time that ANZMAT was also around in the country. So we worked together to try and project the needs, the health needs, the needs for oxygen delivery system, the need for hospital beds, the needs for ventilatory support. So we did calculations and we started preparing for those capabilities. So when we were thinking of bed numbers, we then start setting up the National Gymnasium, and we had two other intermediate care facilities that we set up so that we have a bed capacity that will be available to handle the load of sick patients. When it comes to severe and critical cases, we set up the emergency department. We set up two emergency areas, one with FEMAT and the other one at CWM Hospital, so that they can then handle the load of cases that are coming in. Also with severe cases, we have some severe cases at CWM, and we also handle some severe cases at the FEMAT field hospital. So we were sharing that load. And when it comes to critical care, that is where we concentrate our facilities and resources at CWM Hospital. So it requires quite a bit of planning, and those plannings really need to come out very fast. But it is that time that we were very thankful that ANZMAT is already on the ground. So they assist us with planning the second wave and how we prepare the necessary resources to make sure that we have one goal, and that is to minimize death associated with COVID-19.
Ms. Bronte?
Yeah, I second Dr. Luque's thoughts. It's extremely confronting. And at that time, certainly when the Charlie team arrived, for us, we specifically came deliberately early so that we could overlap with our Bravo colleagues and we could give extra surge to those specialist areas in particular for severe and critically unwell. It's incredibly confronting for frontline healthcare workers, irrespective of their location, to be dealing with very severely unwell COVID, much less in a community or health clinic environment where you wouldn't normally see very sick people. and we wouldn't normally have such an overwhelming need. And so for us, it was very much about giving the right education and helping to arrange those special resources in a way that was most effective, but really supporting each other in meeting those needs and advising nationally where those needs were and how we could best meet those and ensure that every Fijian who needed that level of care had access to that, and that was done in the most appropriate way that we could to ensure the very best outcome. And we see all around the world, critically unwell COVID cases have a very poor outcome, very sadly. And unfortunately, in smaller communities like Fiji, most people know most people, and you're having to care for your loved one or your family member or a neighbour or a work colleague. And so it's very important that we stand together in meeting those needs. But equally, we've learned a lot from other communities' experiences in how we can better deliver critical care and give the most improved outcome that we can for those. And that includes early access. And FEMAT's been an essential part of providing that early access and additional health facilities to help the existing ones meet those needs.
Now, at that time, Dr. Luque, were you really concerned with the way things were heading as far as the number of people were coming in for critical care?
Yes, during that time, there was quite a lot of severe and sick patients coming through the facilities. And that was quite challenging, because then we have to think about the process. And this is where we have to set up our sorting area. And while we are sorting the sick cases, then the other biggest challenge is to make sure that we continue to deliver the necessary care. So even though they come in, we don't put them into the hospital or the main admission area, because we want to make sure that the staffs are well protected with the COVID-19, because we don't want a lot of staffs to be contracted with the virus because of our resources capability. So one of the challenges is, because of the increasing number of severe cases, then we now have to think about keeping them in an isolated area, but we continue to deliver the care that they need. That's quite challenging. When it was happening in Suva, and that was happening in the tented facility, so it's quite challenging. And when he was standing there and looking at how things are rolling out, and you want to plan on what can we do to improve, what can we do to minimize the critical cases, those people who come from with severe, minimizing the process from becoming more critical and even leading to death. So that is where some critical decisions are being done, and also urgent and critical planning are being discussed, so that we can make sure there is a good outcome with whatever capacity that we have at the moment. And I think at that time, with the close collaborations between FEMAT and ANZMAT, that sort of helped a bit. Like when you are struggling, then there's somebody else that come and support you. So that's a very big help that we have for FEMAT.
Now, another question, Dr. Luque, and this should be first for you and of course ANZMAT. We are getting reports of a high percentage of people with severe COVID that are arriving late or are pronounced dead at the health facilities. That has been confirmed by the Permanent Secretary for Health, Dr. James Fong, and also the Head of Health Protection, Dr. Alisha Saukan. What is your message to the people who may be leaving things to the last minute?
Thank you, Mr. Narayan. Our message to the public is that when they are sick, they need to either call 1165 or call 158, or they need to present to the nearest health facility. There was a time that we realized that there were many people that are really presenting very late, or even coming in. Some even passed on at home, and some even on arrival at our facility, they didn't make it. So we were very concerned with that, and that's where the communications have rolled out that we need to encourage the community to please come in early. And one thing I want to mention, and I think with the process of the disease, that window between you still able to walk around. I mean, you will have a fever, you might be coughing, you still feel, oh, I'm still okay. But that window from that time, and then you start to feel that you can move around, or your breathing is becoming a problem. That window is very narrow window. From the time you can still be walking around to the time that you become very sick to being critical, that window is very narrow. And that is why it is very important that we present early. And because we are noticing this, and the other, something that we did was, okay, because some people are not coming in, we need to reach out now. So we also start, FEMAT was starting to assist our public health team by reaching out into the community. We reach out to the people that are out there. We come to their houses and see how they identify those that are even sick, and we encourage them to come into the facility. And most of them that did, they went back home. They went back home, and we found that if they do come early into the facility, then their chances of getting better is very high. So we still encourage people to please come in early and don't wait for the last minute.
Nurse Bronte, from ANZMAT's point of view, of course, we've seen a high percentage of people sadly coming too late and passing away either at home or at the health facility. What's your message?
Very similar, and one which is really a plea to the Fijian community. So the best way to protect yourself from severe COVID disease is to get vaccinated. And it's the one way to protect your family and your neighbours and your loved ones and your broader communities, to get vaccinated. And that helps protect precious resources in the health system, and it protects lives. And what it does is it reduces the severity of illness and the likelihood that people will die from COVID. And what we can then do is focus our resources on, as Dr. Luque has mentioned, getting earlier access. And so if you're feeling unwell or symptomatic, please don't be afraid. Do come forward and get tested. There is a great system that is being supported by FEMAT and the public health colleagues in managing those in the community. In most cases, people are mildly unwell and they can stay at home and be safely monitored. But there are a smaller proportion that become quite acutely unwell and very quickly, as we've heard Dr. Luque mention. And so please don't delay in seeking advice or treatment. Go to your nearest facility or call 165. The outreach teams are there, and even for those communities in more remote places or that are a little bit isolated or difficult to access, there are systems and plans in place. Please just ask, and we will get teams there as soon as we can to help you, but don't delay in presenting. I know it's frightening, and it's very confronting for family members to see their loved ones so unwell, and for the individuals, and they feel like they need their family around them. They can bring you to the health facility or be with you when you're there. It's very, very important that, as Dr. Luque says, we get to you early and give you treatment early, and then your chances of surviving are much, much higher. But please do protect everyone with a vaccination.
Thank you. And I was just going to that in relation to vaccination. Dr. Luque first. Most of the people dying in Fiji from severe COVID, up to even this morning, the results, statistics that are coming out, are mainly unvaccinated or partially vaccinated. What is your message to the people? And if you can also explain to them that it's the unvaccinated majority and the partially vaccinated who are sadly dying from severe COVID. And what does severe COVID cause that people cannot survive if they do not have those types of layers of protection?
I want to support what Bronte has mentioned. Is a humble request to the to our communities that we need to get vaccinated. And I think that is the only way in which we can protect Fiji, because with the vaccination, it will prevent people getting more sick. And then in that way, we won't be overwhelmed with our health resources, with our health facilities in managing the severely sick patients. Around 85% of, around 80% of the people who are dying from COVID-19 are unvaccinated. And there is the other group is partially vaccinated. So that it raises the importance of being vaccinated. I think there is a big fear about vaccination in Fiji. I want to encourage the people out there that the vaccination is quite safe. There's a lot of discussions about the risk of being vaccinated. Yes, there are side effects of the vaccinations, but for the majority of us, we haven't seen anybody directly affected with the vaccines that are in the country. We've started with the AstraZeneca, and now we're bringing in the Moderna vaccine so that it can look after the vulnerable, the high-risk group, the pregnant population. So we are doing all our best to try and make sure that we are bringing in the vaccines that are safe for Fiji. And now there is a discussion about getting the vaccines of the younger age group. So we are doing all our best, and I think I would plead to the members of the public that the only way we can protect our nation is for us to get vaccinated. And when you were asking about the severity of this disease process, one of the main things that that causes death with COVID-19 is respiratory failure. So we started to have fever, flu-like symptoms. Then you start coughing. After that, then you start having breathing problems. Once you start having breathing problem, you are almost at a severe. You are considered at severe category. And that, as I mentioned, that window from severe to critical is very narrow. So if then you present late, then your chance of survival is very low. And as I mentioned, that you can be walking around, we call it a walking hypoxia. So you can be walking around, but the effect of the disease in your lungs it will cause the problems with gas exchange. Then when you have breathing problems, you will start to feel very sick. And when you're brought into the hospital, it tends to be very late. And when you go on to the ventilatory support, not many patients who go on the ventilatory support do survive. So the risk of death is very high in severe cases, in critical cases, cases that do present late into the facility. And then on top of that, if you are not vaccinated, then the risk is much higher.
Ms. Bronte?
Yeah, I would agree with Dr. Luque. I think severe COVID is incredibly distressing for the individual and for the healthcare workers that are caring for them. I've heard some very sad stories and witnessed them myself with colleagues in Fiji, working alongside of fellow staff members that unfortunately have become unwell or being forced to care and nurse for their family members at the end stages of COVID. It's incredibly distressing for people to struggle for breath. It's even more distressing for you to watch your loved one do that. And when something as simple as getting a vaccination and having the second vaccination can prevent that, if you have those tools available to you, please go and have that done, because I don't wish that upon anyone to witness that. And the burden on the healthcare staff caring for the severely and critically unwell is enormous. And they've been doing it for a long time now. And when it's something that we can prevent or lessen, then as a community, we need to stand with our frontline healthcare workers and help them manage that and do whatever we can to make that burden less, because this is an enduring thing that Fijians are going to carry for a long time, as are people all around the world. And it's something that we need to reflect on and think about what we could have done and how we could have done better. And the virus is very tricky. It keeps changing and it's not going away. And we have a tool available to us where you can have 2 vaccinations, and we know that the likelihood of you becoming severely unwell or dying from COVID is very little. And so I think that's something we should focus our efforts on. But I also want to send a big lalomas to all of the healthcare workers right now that are still turning up to work every single day, and in many instances have been working non-stop for at least 4 months. And that's incredibly distressing. So they are doing a fabulous job. Please thank a healthcare worker when you see them next, and give a big smile and a wave to your FEMAT colleagues, because they're out there on the front line protecting the entire Fijian Vivale.
Well said, Ms. Martin, and I was just about to go to that, is that we've got vaccination rates going up, of course, over 95% for first dose and close to 45% for over 45% for fully vaccinated in relation to the eligible adult population. With those numbers coming in, of course, with FEMAT in operation for 4 months, Dr. Luque, are the numbers of severe cases going down, the people who are coming to the hospitals, of course, for care? And how is it affecting your staff who have been at it for the last 4 months?
We've noticed a decrease in the number of COVID cases coming into the hospitals. And as you know, that there is also a decrease in the number of cases. But I want to just for us, it is good to see the trend, but we know that we haven't decided to say, okay, we can relax now. We still feel that we are not out of the woods yet. So my advice is, we are not out of the woods yet, even though it's starting to see the trend, the downward trend. But I think we should still keep our guards up. We should continue with the COVID measures of social distancing, face mask, hand washing, hand sanitizers, avoid unnecessary travels, avoid social gathering. We should continue with those. And with the staffs, as I've mentioned, even though we've seen the trend, but we are still a bit wary of that unknown. So we are still prepared. We continue to have that level of alert, given the situation that it's now gone into the Maritime Division. So we are still continuing with our preparations. And we want to still encourage the people in Fiji that we should not be deceived with this trend. And it should not be a sign that we can drop off the vaccination. I want to still emphasize that we need to move our coverage for the second dose, even up to 80%. I think we need to aim for that, so that we can safely open our containment measures. We can open up the measures that are currently in place, and we can also open up the borders. We can go back to children can go back to school, we can go back to church, we can enjoy the privilege that we had prior to COVID. So I think my advice is we should not be deceived by this downward trend, but I think we as a nation, we need to push for that second dose of vaccination so that our country can be well protected, and we can be guaranteed that if we open up our borders, we are well protected.
Yes, Bronte, just in relation to, we have over 45% of the adult population fully vaccinated in Fiji. There's talk of living with COVID and to continue to practice the COVID guidelines. New variants coming up, C12 just saying originating out of South Africa, a variant that people are talking about, and whether the vaccines work. What's your message on this, knowing that we are at 45% fully vaccinated for eligible adult population? And what would be your message from the point of ANZMAT?
I echo again what Dr. Luque is saying, and I think firstly, let me commend the Fijian community. 96% first dose vaccination rate of eligible population is outstanding. But what we need is every single one of those 96% to go and get their second dose. And we know that only one dose is partially protective, and we are learning more and more about the virus every day. And we are seeing, unfortunately, and learning from other people in the region and communities around the world, that they are getting third, fourth waves of COVID now, and different challenges come with each variant. And we don't necessarily know what all of those are. And the best and most effective way to protect us, apart from vaccinating, is all of those interventions from a public health community point of view that we heard Dr. Luque talk about. And so not to be too relaxed about what is been achieved, but also be cautiously optimistic about what's in front, but be best prepared. And the way we can do that, we've learnt enough about the virus that we can limit its transmission. And so if we can limit its transmission, we can then better manage the outcomes if we do see more variants or other things coming our way. And all of the great lessons, albeit very hard, that we've had to learn inside the health system that have been extremely challenging for Fiji will stand you in good stead as we move forward against that. So please don't be too relaxed and forget all of the things that we've fought very hard to learn and endure over the last 12 months with living with COVID. And I think when we look around the region in particular, we've some tough times ahead. I think we have a little way to go yet before we are completely on top of coronavirus and its impact on our health systems and communities. So please do whatever you can to be prepared and support each other in that process.
Now, Dr. Luque, what is your message to the people who are starting to say COVID-19 is no longer a serious issue for Fiji? The cases are dropping. We can see more people moving around, not following protocols, people moving from containment areas to non-COVID areas, and eventually taking COVID to these places like we've seen in Kandavu, in Malolo, and even in Esawa. What are your concerns and what is your message to the people?
We want to re-emphasize again what I've just mentioned, that we should not be deceived. We know not many sick cases are coming into the hospital. There's the number of deaths have gone down, but I think we need to be careful, and we need to continue with our social measures. We need to be careful because, as you have mentioned, there is new variants are coming up, and if we are going to be opening our borders with our vaccination still less than 80%, that's going to be another very big risk. And I want to plea again that we need to get vaccinated. We need to continue with our social measures. We need to wear masks. We need to wash our hands, and using hand sanitizer. We need to avoid unnecessary gatherings. We also need to avoid unnecessary travels, because when we move, the virus moves. And I think we need to be smart. We need to think of our loved ones. and it's said that the majority of the people that are experiencing the brunt of COVID-19 are the elderly, and these are the group, our population group, that doesn't move around a lot, and it is sad to see that the people that don't move around a lot are the people that are dying of COVID-19. They get COVID-19, they don't get it, but COVID-19 is being brought to them by people who are still moving around carelessly. So I want to ask that we need to be very careful. As I've mentioned, we are not out of the woods yet. We need to be very smart, and we need to be very careful, and we all need to work together to make sure that we do this right, so that we can go back to a normal life, so that we can go back to the life that we want to enjoy, and that we want to enjoy it freely, and not that we finish this and there's going to be another wave and then we have to go through this again. So I'm pleading that please, let's work together. Let's consider all our family members. Let's think about them, and to make sure that that we can all get through this together. And I think if we all can work together, we can overcome this virus.
That's Bronte, that message from Dr. Luque that we are not out of the woods as yet.
I think, unfortunately, one of the blessed things that you have in Fiji is beautiful population in lovely islands that are very spread around, and you have vulnerable population and an elderly population in some of those more remote locations. And it's extremely important that we protect the vulnerable in the community. And the pathway back to normal life in Fiji is by protecting that community with vaccination and allowing us to do that. But until we reach those goals, it's very, very important that we have a very good understanding of those who need more protection and those populations that are more vulnerable, because they normally would have lower access to health services regularly because of where they choose to live. And the challenges logistically in us providing those very specialist medical services, as we've been talking about, is incredibly great. And as we've heard Dr. Luque say, that population aren't moving around. It's people coming to and from them that are creating those challenges. And the way in which we can return to normal life and allow freer movement is to be better socially prepared about how we engage and enact with each other, and the things that we can do that can protect and prepare us better until we jointly together emerge from what has been an extremely difficult 18 months with COVID.
Nurse Bronte, just before we finish off, of course, you have come away from your own home to assist Fijians in battling with COVID-19. Of course, you came when we were faced with very challenging times, with a second wave of COVID at its peak and increasing a lot of concerns on how to react to it. Decisions had to be made. Of course, you came with your team and you've worked with the frontliners day in, day out at the moment in Fiji. It's a calling, no doubt, but what are some of the most challenging times that you have faced, and how have you dealt with it to ensure that you, of course, come out of it stronger, and also looking out for your Fijian counterparts to ensure that they continue to remain focused on what has to be done, and the fight has to continue?
I think Dr. Luque summed it up beautifully. I think together, if we endure it, we can overcome it. And I also think very, very strongly that if we are enduring it, we must learn from it and we must share it, so that others that then walk behind us don't suffer the same challenges that we've suffered. I think for us as frontline healthcare workers and also as the emergency medical team community, we are extremely privileged to be asked to come and walk alongside health services and communities on their very worst days. And that is a privilege to be given an insight to that, just like it's a privilege to spend the last moments with somebody when their life is passing. And whatever we can do to make that more bearable, more peaceful, and more supported, both for the family, the individuals, and the healthcare workers who are enduring that moment in time. That's what we're here to do. And we can learn and work together and stand together, and we can share that burden together. And I think that for me, it is a calling, and the Pacific is very much my family. I feel very strongly that we should not face these challenges alone, and I and my colleagues will continue to come whenever we're asked, and we continue to work together, because that's what we do. We're good neighbours in the Pacific, and we understand our ways may be slightly different, but our needs are still the same. And we are very blessed to have shared a really long and enduring relationship, and I know that that will continue into the future. Dr. Luque and I met in Cyclone Pam. We had done training for that, so I'm sure this is not the last time we'll work together in the field, and I look forward to working with him and his other colleagues going forward. Vanaka Vakalevu, Lalomas to everyone. Thank you so very much.
Thank you, Bronte, and of course, it's a great blessing to have the ANZMAT team do so much for the people of Fiji, and to stand side by side with our Fijian frontliners who really needed your support, as Dr. Luque said. Dr. Luque, you've definitely seen the worst. 4 months of trying, verified as a health center facility, to step up to the plate to ensure you become a facility that can look after COVID patients. You've had people from the north come in thinking they may be here for a few days or a few weeks, staying on for 4 months. Definitely a lot happening behind the scenes of people getting frustrated, distressed. How have you managed to keep the team together, and how have you managed to cope so far?
When we were called to Lautoka, when I thought about it, it's quite a challenging. We were advised that on Wednesday evening that FEMAT needs to move to Lautoka and set up urgently. We have to get the pieces together. The good thing that FEMAT is already have the capability to respond, and we did that with the support of the ministry and other government stakeholders. I met this group of staffs from Lambasa. They flew in. We met briefly on that evening, and I told them this is going to be long, and I think that's what I've learned in disaster. As Bronte has mentioned, we were together in Vanuatu during Tropical Cyclone Pam in 2015. When Fiji responded, we were supposed to be only going for 2 weeks. We ended up with 6 weeks. So because of that, I front up to the staffs and I told them, you are here to be here for 2 weeks or 1 month, but I just want to tell you up front that this is going to be long. And I'm happy that they've taken it on. They really stood up to the challenge. We went to Lautoka, we set it up. And as I mentioned that FEMAT is not alone, and we are thankful for all the support that we have from the ministry, from the government, other stakeholders, and even the communities. And I want to mention at this time that there are many people that are coming in to support. While we were in Lautoka, even here and in Suva. And I must say that I can't name each and every one of them individually, but there are people who come in, they come in and giving some lunch packs, preparing some meals for the staffs. And these are the things that kept us going as a team. And I must thank all of them. And I know that not even that there are people that are out there, they are praying for us, they're thinking of us, families. And I must also thank the families who have allowed their some mothers, some fathers, some children of families that are being deployed for for 4 months and being separated from families. And I must thank the families for their continuing support. The team have really blended in well, and we've really worked hard together. And this is a challenge. And I'm thankful that that EMT have really prepared us in thinking ahead, preparing for the unknown, working on things that you don't have, how you can be innovative. We know that FEMAT has got a standard, and one of the important things that I mentioned to the staffs, you have to know that FEMAT has got a standard, and it's an internationally recognized standard. We can't drop that. It's either we maintain it or we lift it up. And we did that. And we mentioned to them because we have proven that we can maintain that standard, and we worked on it. We might not be perfect, but we've given our best. And I must thank everybody for their support. As I mentioned, that FEMAT was verified as a type 1, but in this deployment, we've set it up by, I think we've gone up to type 2 in the way we've responded with COVID-19 from Lautoka and then to Suva. And to me, we have shown that as for Fiji, we at times we punch beyond our own weights, and we have shown that, we have done that. And I must say that with this COVID response, it's not FEMAT alone. I think we have done it as a nation, as a people, and I think we need to continue to work together. And FEMAT is a community, and there's an EMT community out there. The ANZMAT have come in. There's still groups that are still willing to come and help, and that is the EMT community spirit that is out there, that we are not going to be alone, that we've got people out there that are thinking of us, and they are also ready to support us in this COVID fight. And I must thank everyone for the support, and also to all the health staffs, the frontliners that are out there. And I want to thank them for all the hard work that they have put in, braving the harsh conditions, braving the weather, braving some, as we speak, there are a few groups that are braving the waves out there in Kandavu, and also in Malolo and in Tayasawas. And I want to thank everybody for all that they have done. And we know that the spirit is there, and I think we should all encourage one another. And while the frontliners are there, I want to end with my humble request to the other members of the public. Let's do our part. Please get vaccinated. Please take heed of the social measures that the Ministry of Health and the government is advising us. And that is the only way we can get back to that normal and enjoyable life that we want. Thank you so much.
Navalevu, thank you very much. Two very busy people. Of course, the FEMAT had Dr. Nasedra and ANZMAT team leader, Nurse Bronte Martin. We thank you very much for your time, and of course, very candid conversations about what has happened behind the scenes in the last 4 months with the battle against COVID at the peak of the second wave of COVID, and the request by both. Please do get vaccinated. If you have taken the first dose, please ensure you take your second dose and get fully vaccinated to help those frontline workers who continue to stand for the people of Fiji, to continue to protect the people of Fiji. If you have severe COVID symptoms, if you have COVID symptoms, please do go to a health facility immediately, and also ensure that you encourage all those around you who are eligible for vaccination to get vaccinated. And lastly, we are not out of the woods yet. Please continue to follow all the COVID-safe measures after even getting fully vaccinated. Until next week, good evening.